Welcome, brothers and sisters, to your wellspring of knowledge. Remember that knowledge never be toxic to brain, but public serving and saving oriented. Today's topic is smoking. Smoking, it's a habit of taking tobacco or cigarette. Now, see the topic of today. But I try to divide it into two parts. Part one is smoking in medicine. Friends, now in this topic, which is part one, we are going to cover definition of smoking, effects of smoking on the body systems, especially cardiovascular and the pulmonary system. In the second part, we will cover other sessions about smoking and surgery. In that topic, we'll see what you have to consider when you meet the smoking patient who is going to undergo surgery. Second, we'll see medical surgical implication of their damaged body systems. Third, we'll see how to manage the anesthesia in a smoking patient. Now, friends, let us go on with smoking in medicine. Friends, what is smoking? What do you understand when we say smoking? Smoking refers to the practice or act of inhaling or exhaling the fumes from cigarette. And these fumes holds many addictive substances. That's a brief summary about smoking. Friends, we have seen what is smoking. Smoking is the leading source of toxic mixture or of chemicals that harm our body, including nicotine, carbon monoxide, hydrogen cyanide, ammonia, butane, formaldehyde, benzene, vinyl chloride, polonium 210, chromium, arsenic, cadmium, and toluene. These are the main constituents of smoking tobacco. Friends, cigarette contains over 4,000 substances. Some of them are harmful to the body. Some of them are also able to cause both cardiovascular and the pulmonary problems. Now, how does it happen? Friends, when these chemicals get deep into your lungs, they damage the blood tissues inside the lungs. They cause the impairment, and your body must fight to heal each time you smoke. Over the time, the damage can lead to a disease. For example, emphysema, bronchitis, chronic obstructive pulmonary disease. Your lungs, blood vessels, and other delicate tissues become irritated and damaged when you smoke. The chemicals in the tobacco smoke reach specifically in your lungs quickly when you inhale, as some way that the oxygen gets into the blood. These chemicals also reach the blood rapidly to adversely affect all body systems, especially cardiopulmonary systems. Therefore, as much as you smoke, you increase your risk of serious cardiovascular and pulmonary complications during and after surgery. Friends, now we are going to see what are the effects of those smoking constituents. But now we are not going to cover all elements of smoking fumes, but we are going to be more concentrated on those two things, nicotine and carbon monoxide. First, you have to understand what's nicotine. What do you understand when we say nicotine? What do you understand when we say carbon monoxide? Because you are not going to know what the effects that these things have on the body once you don't have the knowledge about them. What are they? Friends, let's start by nicotine. Nicotine is a powerful addictive alkaloid nitrogen containing compound which holds both exaggerated pharmacodynamic and psychodynamic effects like increased heart rate, increased stroke volume, increased oxygen consumption, and a sense of relaxation or euphoria, which makes most people who are smokers get much addicted. But we have to not forget also hypoxemia, which leads to severe chronic hypoxia. Friends, that's all about definition of nicotine. It's a powerful addictive molecules which is alkaloid. Now, carbon monoxide, it's a poisonous gas, of course, which is odorless, colorless, and tasteless, but it holds a capacity, much capacity and ability to combine with hemoglobin to form carboxyhemoglobin, and then result in low oxygen release to tissue level. Friends, let us start by pulmonary system where those gases gets lead into the body. Now let us see pulmonary system. Friends, oxygen transport and delivery are greatly affected by smoking in three main ways. First one, it affects the oxygen carriage in the blood. Second, it damages the airways. Third, it distorts cardiovascular changes or transport of fluids and blood pressure in general. Let us go on with first, which is how does those two molecules, nicotine and carbon monoxide, affect the oxygen carriage. Friends, let us go on. Under normal circumstances, after the blood has passed into the lungs, hemoglobin is almost fully saturated with oxygen, even in the face of slightly reduced oxygen in the alveoli. In the smokers, various changes occur because of increased concentrations of carbon monoxide, and this affects oxygen carriage in two ways. First one, it's this: hemoglobin uh, has higher affinities between uh, 250 times more affinity for carbon monoxide than oxygen. Therefore, the total amount of hemoglobin available for the oxygen is obviously reduced. That's one. Second, carbon monoxide shifts the dissociation curve to the left, which reduces the ability of hemoglobin to release oxygen to the tissue. How does this come? To make matters worse, carbon monoxide also inhibits cytochrome oxidase, the enzyme that is needed for the final oxygen-dependent synthesis of adenosine triphosphate in the mitochondria. This compromise of oxygen delivery is more and more threatening for smokers. And as treatment, please administering 100% oxygen will significantly help the remove of carbon monoxide to the hemoglobin, and then oxygen takes over, and then better oxygen leads to tissue. Second, phlegms. You have to know that all smokers have irritable upper airways, which increase airway secretions. In turn, this increases the chance for breath holding and laryngospasm, especially during induction of anesthesia. This is a sure and a corner concern for anesthesia providers. Remember, the most commonly used anesthetics are bronchodilators. Allow some such as isoflurane and deciflurane have a direct irritant effects in the airways. And remember that postoperatively, when the patient is fully worn of volatile anesthetics, the bronchodilation produced from those inhalational anesthetics ends. Please pay attention for the occurrence of laryngospasm and bronchospasm for those patients, because it's usually occurs once you don't pay attention on those patients and those serious effects of smoking. Friends, you have also to know that lower airway reactivity is also increased in smokers, and the action of cilia is impaired. Now to clear those wastes from the lungs is still the problem, which can expose the patient airway to infection. Please, all those will have much effects to the oxygen saturation and utilization of the body. Now let us make another thing on cardiovascular system. How does smoking affect cardiovascular system? Friends, nicotine and carbon monoxide are the primary harmful constituents of cigarette and smoking, as you have seen. Under influence of nicotine, friends, you have to know that adrenomedulla is overstimulated and it produces higher lasting plasma catecholamine concentration. You know, those catecholamines intervene in the increased alpha 1, alpha 2 action. So you have to pay attention, friends. It moreover excites the sympathetic system, which results in the increase in heart rate, BP, peripheral vascular resistance, myocardial contractility is also increased, leading to the increased oxygen demand and consumption. Friends, don't forget that nicotine increases intracellular calcium during ischemia. This may exacerbate myocardial cell damage and then heart failure. And you have to know also that this reduced coronary perfusion leads to depressive ST segment on the electrocardiogram during general anesthesia. Friends, that was the nicotine. Now on the carbon monoxide, you have to remember that in the blood, carbon monoxide combines with hemoglobin to form carboxyhemoglobin. And the affinity of carbon monoxide for hemoglobin is between 200 and 250 times uh, that of oxygen. Thus, the amount of hemoglobin available for oxygen is very low. This shifts oxygen hemoglobin curve to the left in three ways. First, higher affinity of carbon monoxide for hemoglobin. Second, change in the shape of oxyhemoglobin curve from sigmoidal to more hyperbolic curve by carboxyhemoglobin. Third is the depression of 2,3-D phosphocrystalate by carbon monoxide. Let us go on with miscellaneous adverse effects of carbon monoxide and nicotine on the body system. Friends, you have to know that smoking affects the GIT with increased risk of peptic ulcer disease. That's one. Second, you have to know that it increases also the chance of having GERD, gastroesophageal reflux, and Crohn's disease. That's one. Second, you have to know that all those pathologies affects the body in one way or another. For example, the patients with ulcerative colitis are more likely to present for the first time after stopping smoking. And all those pathologies will lead to poor nutrition of the patient. Nicotine is powerfully addictive, as we have said. The impaired humoral activity and cell-mediated leads to impairment of immune response, which results in increased risk of infection and malignancy. You have to know also that it decreases the immunoglobulins and the leukocyte activity, which in turn leads to poor immunity. And from that, you have to know that smoking results in increased secretion of antidiuretic hormone, leading to directional hyponatremia. So this is the summary. How does nicotine affects the body in general? You have to know that nicotine, it has the vascular dysfunction, where it increases the circulating free radicals, oxidative stress, nitrous oxide bioavailability. You have to remember that you have decreased vasodilation, increased vasoconstriction. It affects the body also by increasing the metabolism of lipids, which will expose the patient to endothelial dysfunction and damage. Second, it's the development of atherosclerosis, which also leads to endothelial dysfunction of the vasculature and then damage, finally, to cardiovascular dysfunction and disease, such as hypertension, myocardial infarction. You have to know also that nicotine dysregulates the cardiac autonomic function, where it increases sympathetic activity, parasympathetic activity, blood pressure, heart rate, and then cardiovascular dysfunction and disease. Friends, you have to know that once you have a higher level of nicotine in the blood, it increases the chance for having insulin resistance, and then atherogenesis, which leads to hypertension and diabetes. This is the effects of carbon monoxide in the blood. No, but not only in the blood, but all over the body. Yes, the carbon monoxide is going to affect body parts. How? Carbon monoxide, as we have seen above, it decreases the availability of oxygen to tissue, which will cause myocardial ischemia. It also leads to endothelial dysfunction and damage, and then development of atherosclerosis, as you have seen, and then myocardial ischemia due to decreased oxygen in the coronary system. This is another one which the decreased oxygen supply to the tissue due to higher carboxyhemoglobin instead of oxyhemoglobin to the tissue level, and then it ends up to decreased performance due to the lack of energy. Because once the oxygen is low in the body, the glucose are not going to be burned to produce the ATPs that are needed to convey the metabolism of the body. Now, it's once the oxygen is not available, we are going to have an anaerobic respiration, which will lead to lactic acidosis, and then lack of energy and cardiovascular dysfunction and disease. Friends, thank you for your time to take watching this video, learning together with me. Please, this is the first part of presentation, which is smoking in medicine. Please subscribe, share, like, and comment so that you will be the one to get the next